your back.
You are on, Andrea.
Welcome, everyone. We're so excited to welcome you to our 57th anniversary celebration for the Economic Opportunity Program. So we would love to have you engage throughout this entire meeting in this session. So please put your names in the chat box. Many of you are coming in through Facebook Live. Some of you are in through StreamYard. You might be in through YouTube. But please, let's engage. We want to make sure that you're able to also, when we have our keynote speaker, you are able to ask questions, and then we'll continue to move through. So we welcome you. We're so excited as we begin this annual meeting. So we're going to move through and begin to talk with you about, for our 57th annual meeting of the Economic Opportunity Program, our hashtag and theme is Built to Last. So we are so honored to be able to welcome you on behalf of our committed board of directors, on behalf of our dedicated staff and our volunteers. We want to welcome you today to this annual meeting. Think about it, 57 years we've been serving our community, Chemung and Schuyler County. And we really appreciate you attending today because so many of you have supported us through this work. So we are really honored that you are able to be here to celebrate with us. We've had a tough 2 years, everyone has, as we've been trying to manage through the scourge of COVID-19 and other challenges, which have been challenged, all of our systems have. But we want to be able to celebrate for a moment, to talk about what we've learned, to talk about our challenges and maybe some of our doubts, but also to talk about what we believe has been our guiding principles, which are our core values. For us, today we have as an agenda a brief overview of our annual report highlights and the accomplishments and what we want to focus on for the upcoming year. We'll actually give you an opportunity to give us some feedback and to help us prioritize our top 3 strategic areas of focus. And also, if you'd like to receive a digital copy of the annual report, that's available to you as well. We also are honored to have a keynote address a little later by Wade Norwood, who is the Chief Executive Officer of Common Ground Health. And also, if you've ever heard Wade speak, if you haven't, you're really in for a treat. But if you have heard him speak, you know that Common Ground Health is data-driven. And so they are phenomenal in terms of the research that they do, data from a local and regional area. And then from that data, a strategic planning process is what they take a group through. And from that strategic planning process, you're able to prioritize what will be the areas of health, one, that need to be addressed in your community and addressing the social determinants of health. And then 2, what's your action plan? So be listening as Wade comes forward later with the keynote address, because there's going to be a call to action. There is always a call to action with Common Ground Health. We've had an opportunity to work with them, appreciate Melissa Windland and many members of their team who we've been working with since actually 2018, and then a high impact assessment was done. We actually reported, for those of you who've attended our annual meeting in the past, we shared with you what some of the strategic areas of focus from a health perspective needed to be for our area. So now what we're going to also report on is our progress, because it's one thing to have a plan, but it's another level to be able to implement that plan. We also, once we hear the keynote address from Wade Norwood and the challenge, there's always a challenge there, a call to action, we have a panel response from our own community experts and leaders. Dr. Gina Kyler, Vice President of Health Equity and Community Investments from Excellus Blue Cross and Blue Shield. We also, as a part of the panelists, have Mayor Dan Mandel, Mayor of the City of Elmira, and he's also the Vice President of the Economic Opportunity Program's Board of Directors. So we're excited to have them as expert panels to talk about what did they hear in the challenge and charge from Wade, but also what are some of the areas that we've already been working on. So I think it's going to be a great evening of you gathering great information, but also there will be a call to action. As our attendees today, you will be able to engage by putting questions in the chat box. And also You will then be able to even share and help us prioritize our top 3 key areas of strategic focus, because you did that last year, and community health was one of the areas that you prioritized, along with COVID-19 response. And we listened to you. You are our stakeholders. We value your input. We wouldn't be able to serve the 5,000 people that we serve annually without you. So we really appreciate your engagement, even in this annual meeting format. We also would like to be able to, again, if you're interested in a digital report, we will have a link for you that you can sign up to go into that link. And then that way we'll know to send you out a digital annual report. So I want to just check in, because we want to make sure that all of our keynote speaker is here. I see our panelists are here. Has our board gotten in? Is our board president Herb Smith in yet? Because I want to make sure that we're able to move forward there if Herb is on. Is Herb in? Just want to check in with my tech team. Want to thank those who are involved.
Herb is watching on Facebook, but he's not into the green room yet.
Oh, okay, great. So probably if you can send him that link, he'll be able to get in. So what we're going to do is jump right in. And we're going to jump right into our focus and hashtag of being built to last. As I said earlier, we are 57 years old. For 57 years, EOP has served the community with program and services in both Chemung and Schuyler County. So for us, as we advance, and I have a slide presentation we'll move through quickly as we give you a strategic overview and give you an opportunity to sort of review that as we do that together. So again, in our focus for us, we've learned a lot during this time of COVID. EOP never closed its doors. Since March 2020, we've continued to serve, and I'm so proud of our staff. We have many of our staff who are on, and I just want to thank each and every one of them. Thank our board of directors. We have a phenomenal board of directors who help us set the vision, even as we work to respond to the unpredictable nature of COVID. We kept our doors open. We continued to serve. We came up with innovative ways, serving at curbside with breakfast and dinner service. We were able to look at ways to look first at our core values, because it's from our core values of serving our community that we were then able to frame what our next steps would be. So when we think about Built to Last, we also know that individually, you've been through the same experience that we have, individually, corporately, professionally. So again, please know that we can learn together. We can come together in unity and harmony as a community, learn from even our mistakes, learn from our successes. And then that way we can forge ahead, so that no matter what the changes might be that we're faced, no matter what the issues are that we're working through, justice, inequality issues, health disparities, we can come together as a community to accomplish them. So again, it's so important that we recognize what we've built a resilience, we've been agile, we've all been flexible, we're still standing. That's a really good thing. Individually, professionally, corporately, we are still standing. We've learned something over the last 2 years. So let's continue to learn together as we forge ahead our next steps. So
Andrea,
I would like to welcome our
Herb has
board
joined us.
president. Okay, great. Our board president is going to step on, and he's going to officially open the meeting. Thank you, Herb.
Okay, welcome everybody. Thank you for joining us tonight. I want to welcome you to the 57th annual virtual board meeting of the EOP. Thank you all for coming, and I hope you enjoy yourselves. Thank you.
Thank you so much, Herb Smith, our president. So as we move through, we will talk about the vision, mission, core values of the Economic Opportunity Program. We are really built to last. And so for us, we believe that people at our core and at our values, we believe that people are to live with dignity. The families and communities are truly the foundation for individual stability and growth. We believe that diversity, equity, inclusion, and justice, they are really important because they represent the unique contributions of every individual. We believe in active community participation and involvement by government, community leaders, donors, human service providers, and others that enable people to enjoy economic stability and growth. We believe in community. And so we have representatives even today. Many of you are our government leaders, our business leaders, our donors, our participants, our staff. You're all here together, and we appreciate all that you do to help us achieve the vision and mission of the Economic Opportunity Program, which is to provide those services that create that positive change in individuals, families, and the community, and encourage and facilitate the participation of all people. If there are barriers to access services, healthcare, and other things, we work really strategically to remove those barriers. So that's what we're focused on. Our dedicated staff, and they are truly a dedicated staff, they provide excellence in services that help create those positive changes. And so we really want to appreciate our board of directors, Herb Smith, Mayor Mandel, Rick Beals, Georgia Verdier, Evelyn Williams, Marty Chalk, Roland Coleman. We are so appreciative of each and every one of you. We have we want to appreciate new board members, Sasha Coates, also Carol Kane and Holly Strickland. Want to appreciate Dr. Mustaf Sheck, Guy Vickers, Margaret Walls, Michelle Wasicki, and Nan Woodworth. Those are our current board members who help us frame the strategy to move forward. Our executive team is a very powerful operations team. Anthony Prasad, our Chief Financial Officer, Bill Brzezinski, our Chief Program Officer, Anita Lewis, our Chief Development Officer, and also Brianna Storch, our Human Resource Manager. Those individuals, along with our dedicated staff, allow us to provide these quality services. We have a caring staff, and annually our staff provides the support to more than 5,000 people, focusing on our core values, also our core competencies of childcare, youth care, family, and community development. That's our vision and mission at EOP. So when we look at the strategic areas of focus, those are noted, and how we are able to plan programs, we are focusing on these entry points that allow us to activate our core values with programs and services. So access to healthcare. We partner with Common Ground Health, as I mentioned, since 2018, 2019, partnering with Arnott Health as well for the access to healthcare, because there are barriers and blockers to healthcare. We're working also to be leaders in child and youth care. And so for us, we are partnering with our child and youth care teams, Early Head Start, Ernie Davis Community Center, Centers for Excellence, providing even after school programming as well. We continue to work, even as we look at the areas of health, access to healthcare, partnering with Excellus, Blue Cross Blue Shield, and also even Chemung County Health Department. You'll hear more about that. And so as we look at the access to healthcare, what you will see is from the Rapid Health Impact Assessment, we also continue to look at how we could ensure that even the houses in our area were properly treated in terms of lead abatement, and also to even test children. So what you'll hear tonight will be our strategies and plans that we've been putting in place. If we go back to the former slide, through family and economic development, we provide family support services, community food for jobs program, literacy volunteers, energy services, and also the Libertad Elmira supportive care for veterans. Housing and food security we impact, working with Vecino as well as the city of Elmira. So I wanted to give you just a quick overview of our programming and how we connect our programming to our core values and our strategic focus. You might ask the question, what informs our work? And so in an ever-changing, you can advance the slide, thank you, in an ever-changing field, we look at even once we received the Rapid Health Impact Assessment, it wasn't a surprise to any of those stakeholders in this community. But we began to work with Common Ground health to say, what can we do? We partnered with the City of Elmira. We work with Arnett Health, with LECOM to say, what are some of the next steps? What plans can we put in place so that we can truly begin to remove these barriers to access and to address these issues head on? So as we look at what's our foundational focus, Maslow's hierarchy, and that's our next slide. We began to look at even Maslow's hierarchy, which has basic needs. Food, shelter, clothing. You're probably very familiar with that. But what becomes difficult is when you're hungry, it's difficult to move to those higher levels of actualization, to even be open to learn if you're in an academic environment. Even if we provide, for example, vaccinations, if you go back to an apartment or a home that has lead, then there's still issues. There were issues pre-COVID. But now COVID has actually exposed some of the other issues, as well as historical trauma that might have impacted an individual. That trauma might be generational racism. And so again, we want to begin to provide programs and services that address the real issues head on. As we look at the next slide, it's important to look at justice, equity, diversity, inclusion, and the reality around it. And the bottom line is justice. There are barriers to access, for example, for healthcare. It's important, even when we looked at partnering with our other health partners around COVID-19 and the response and trying to get the vaccine clinics out. What we found is that there were some individuals in the community who didn't have access to the vaccine. So if you go back to the other slide, we are working together to move to that place of justice where those barriers and blockers get removed and it supports everyone. And so again, we have to look at the causes and then begin to look at how to remove those systemic barriers. We began to partner, if you move to the next slide, we began to partner with Vicino, CVS. January, February of 2021, we hosted vaccine clinics, vaccinating more than 100 people. We also partnered with Chemung County Health Department in February of 2021 and hosting some health equity pop-up pod clinics. More than 200 people were vaccinated then. And then as we continue to move forward, we've partnered with Arnett Health with more than 650 vaccinations given and more than 11 vaccine clinics hosted with 1,100 vaccinations given. So that's how you begin to provide access to ensure that people who might not have transportation to get to a larger facility, they may not be comfortable going outside of their own community. This is an example of how you remove those barriers to access. So thank you. That's one thing I wanted to share and highlight. We're also hosting a pediatric clinic with Arnett Health. And so that will be at the Ernie Davis Community Center, Friday, February 25th from 3 to 6 p.m. So please help us get the word out because again, we want to provide the programs and services that give access to all people and make it easy for them to engage in healthy practices. Also, I'd like to share, as a result of our work with Common Ground Health, we were able to work along with Excellus Blue Cross and Blue Shield and receive a Mackey community grant. And that grant allowed us to develop a new community health screening resource center. And that's opening in spring of this year. It's called the ACEL Clinic, the Arnott Chemung County EOP LECOM Health Screening Clinic, supported by, again, the strategic guidance of Common Ground Health, underwritten by the Mackey Grant, Excellus Blue Cross and Blue Shield. So more information will be coming. In phase 1, we will be focusing on lead testing. You might ask, Andrea, how do you measure your success? Well, we have many outcome measures, and we are audited annually for our financial results, and our financial results continue to improve. You can see that our largest funding area is for childcare, our Head Start program, early Head Start program, and we've been able to successfully pass all of our audits as we've moved forward. We have many outcome measures, but we also measure a person at a time. So we want to share with you with a special greeting from a few of our favorite friends, from a few of our favorite people who are benefit from your support that you provide the Economic Opportunity Program. This is a song from the Ernie Davis Music Consortium. Three Little Birds.
Ready? Go. Don't worry about a thing, 'cause every little thing is gonna be alright. Singing, don't worry about a thing, 'cause every little thing is gonna be alright. Rise up this morning, smile at the rising sun. Three little birds pitched on my doorstep, singing a sweet song of melodies pure and true. Saying, this is my message to you. Singing, don't worry about a thing, 'cause every little thing is gonna be alright. Singing, don't worry about a thing, 'cause every little thing is gonna be alright. 'Cause every little thing is gonna be alright. 'Cause every little thing is gonna be alright.
Wonderful job. And that's why we do what we do. Because for us, we're committed to work together as community to ensure that for our children and for everyone in the community, that as we work together, we can be built to last and everything will indeed be all right. I'd like to segue, and please feel free to engage in our chat box if you have questions or even comments or requests, because we're ready now for our keynote address. And hopefully you found the overview of our agency and our strategic areas of focus helpful. But I'd like to introduce our keynote speaker, who will talk with you about how we pull all of it together, especially from a health impact perspective. That's Wade Norwood. Wade is the Chief Executive Officer of Common Ground Health, and we are so excited that Wade will be speaking, and I will introduce him in a moment. I also want to share, as I said earlier, we will have a panel response from community experts and leaders. And that response will come from Dr. Gina Kyler, Vice President of Health Equity and Community Investments, Excellus, Blue Cross and Blue Shield, and also Mayor Dan Mandel from the City of Elmira. He is also the Vice President of the Economic Opportunity Program's Board of Directors. So we welcome and thank and appreciate our keynote speaker as well as our panel expert response. An introduction of Wade Norwood. For some, you may already know Wade Norwood, but for some, it's an introduction and a presentation. Wade is a Rochester native. He has held community leadership positions for more than 3 decades in management at Common Ground Health since 2006. And Norwood has really been central to the nonprofit strategic planning process, pushing the organization to become more effective as a change agent for all of Finger Lakes region residents. As a part of his leadership and efforts of his team, we're able to open this cell clinic, which will truly have a lasting impact in our community. Wade has many leadership roles at the state level and also at local levels, which include co-chairing New York State's Health Department's work group on healthcare workforce and co-chairing the Region's Systems Integration Initiative with Congressman Joseph Morrell. As a member of the Finger Lakes Regional Economic Development Commission, Wade has helped to guide funding for economic development, job development, and also anti-poverty efforts across the region. Since 2009, Wade Norwood has served as an at-large member of the New York State Board of Regents, which is responsible for general supervision of all educational activities in the state of New York. He's also a board member of the National Network for Regional Healthcare Improvement. He's a leader in Rochester's faith community. He's the president and senior pastor at the Holy Jerusalem Spiritual Church. Wade Norwood is a graduate of the University of Rochester, where he received his bachelor's degree in political science. He and his wife, Lisa Hardy Norwood, reside in Rochester's 19th Ward neighborhood. They have 2 adult children. Wade believes in community. He leads out in community, and he lives in his community. And again, he lives his core values through the community. So please join me in welcoming, introduction to some, but to others, presenting Wade Norwood, the Chief Executive Officer of Common Ground Health. Wade, it's great to see you. Thank you so much for being here.
Andrea, thank you so much, and thank you for that very gracious introduction. Friends, it's a delight to be with you this evening, and I am really grateful for being the keynote on such an auspicious occasion. My aim is to be brief, but my aim is to also be provocative in order to fuel conversation among the panel and all of you. I would be remiss if I did not stop to just note how blessed I am to have come into relationship with the Economic Opportunity Program of Chemung and Schuyler counties. And please allow me to open by congratulating you on how you work towards strengthening the fabric of Chemung and Schuyler County communities. And I am really grateful, Tom. I understand that you're advancing slides for me, so I'll just say next slide and hope that that allows you. Why don't you bring up the next slide and let me, friends, further introduce myself. Next slide, Tom, by introducing Common Ground Health, which is the health planning entity for the 9-county Finger Lakes region. We see it as our mission to bring focus to the health issues experienced here between Buffalo and Syracuse, between Lake Ontario and the Pennsylvania state line. And I will say that in happier days, and I'm praying that happier days are soon on their way to us, I get to travel the region. I was last down in your community in June of 2021, when I thought it was going to be safe to be back out constantly. I was overly optimistic of where we were in the pandemic journey, but that was my most recent 3 days down in Elmira and Corning and combing my way through Schuyler, Chemung, and Steuben, meeting with your colleagues and seeing all of your work in action. And I look forward to getting down there again. And I have invited my nephew in New York City to come up and join me because he is absolutely thrilled at the fact that he might make his way to see a race at Watkins Glen in 2022. Next slide, please, Tom. And allow me to thank Melissa Winland, who is our Director of Strategic Initiatives. And one of those initiatives is the Central Southern Tier Alliance. And I'm just getting a warning signal here of a low battery, so forgive me as I unplug something and plug something else in its place to make sure that we don't lose connection during this call. Let me say to you that in my work, I found a picture is worth 1,000 words. And so this slide shows you an adaptation of one of my favorite pictures, and consider it to be a microcosm of our entire region. As I show you 2 maps of Schuyler, Chemung, and Steuben. On the left hand, those counties are color-coded by census tract to reflect life expectancy of the population of the folks who live within each county. The darker the color, the longer the expected life expectancy, the better off people are. The lighter the color, the higher the incidence of folks who live in our community dying earlier than they should. Years of potential life lost. The map on the right is our aspirational vision of what it would be like if every one of our neighbors had access to the health and health supporting resources that they required in order to be able to live their lives out as expected. Next slide, please. And I want you to know that our work has been really centering on micro-targeting these years of potential life lost across the region to match, as you can see here, with data that allows us to understand socioeconomic status of the folks who live within each of those zip codes or census tracts. And I want to go back to Andrea's comment about Maslow's hierarchy to really make the point to you that poverty literally is killing us in the Finger Lakes region. And I know it may be hard for you to believe, but when I show these maps of Central Southern Tier, when I show these maps of the whole region, and I've been showing these maps since 2006, there continues to be shock and amazement because of our tendency to believe that poverty and all of the problems associated with poverty are relegated to the inner cities of Rochester and Elmira, and that the rest of the region just lives in bucolic prosperity and wealth and abundance and good health. If you'll advance the next slide, I would say to you that none of this is new. It is sad that it's still surprising. And it is the absolute proof of the purpose and the value of the EOP. And it's also a sign of the work that we have to do because we have been very much involved since the early 1960s in doing our work and explaining what's going on. And as this slide shows, we can tell you with real specificity not only what's going on with regard to health, not only how it's concentrated among folks who are living in poverty, and we can cross-tab premature mortality with age, race, ethnicity, income, and geography. I mean, my golly, we are really good at talking about what's going on. But we've come to understand that our job is to also talk about why. And that's the work we've been engaged in since 2017. It began underneath my predecessor, and I consider this work to be her amazing legacy. Because in 2017, we committed to developing a regional health survey that we administered in 2018 that would help advance our understanding from what's going on to why. And I need to interrupt myself and thank Brian Hart and all of your public health directors and community service directors and mental hygiene leaders, because they were key partners in our executing this survey. We aim to get 2,000 responses. Next slide, please. And we wound up getting 6,855 responses with the appropriate oversampling by race and ethnicity, by income, by age and geography, so we can cross-tab to a fare thee well with statistical validity. And this is the key point of my remarks. This is my major leave behind, and I am now floating towards the exit. But I want you to know that my major takeaway from this 2018 survey, which really formed the basis of our 2019 overloaded report on the nexus between health and poverty, what was most impactful for me was this finding with regard to mental and emotional health. That when we asked our neighbors to rate their own mental and emotional health. 90% of the respondents told us that they rate their mental and emotional health as good, very good, or excellent. And that's a great Chamber of Commerce finding for us. But it means that 10% of our neighbors said that their mental and emotional health was fair at best, if not simply poor. And as you can see from this slide, if we zero in on that 10% and start looking at just those households with incomes less than $25,000 a year, those folks, urban, rural, or suburban, who rate their neighborhood as unsafe, those folks who tell us that in their daily life, they face transportation barriers, particularly with regard to accessing food. 10% becomes 54%. And since I had to take statistics twice as an undergraduate, I understand that 54% in statistics means it is the norm for folks with whom we interact who fit these conditions. It is normal for them to say that their mental and emotional health is at best fair, if not poor. Next slide. Next slide, please. And for our purposes tonight, I just want you to know that when we talk to people and listen to them about what are the things that contribute to poor mental and emotional health, poor health overall, housing status jumps out as a very significant determinant of health. For folks who are owning their own home versus those who rent, and those who are unhoused or unstable in housing. Incredible differences in health self-reports. Next slide. And that's why I thank Mayor Mandel not only for his presence tonight, but for the active engagement of the City of Elmira's administration in health improvement by focusing on housing. It's impossible for me to overstate the incredible value that we have found in our partnership with the EOP, because data only becomes information when it's bathed in community voice. And you all should know how key you've been to helping us draw the concrete links between housing and health in the city of Elmira. Next slide, please. And that work culminated a few years ago in our health impact assessment that draws the data links between poor housing and poor health. And this HIA and its focus on elevated blood levels across Chemung County, I hope continues to be part of the fuel that you all are able to use as a community esprit hub to continue to uplift and close the health equity gaps that exist in our community, because they are foundational to solving the health equity gaps that exist within the region. Next slide, please. And as Andrea said, after the HIA, a team including EOP, Common Ground Health, LECOM, Arnett, and Chemung County and the city applied to Excelis's Member and Community Health Improvement Initiative. That's the MACI that Andrea referenced earlier. And this multi-year 6-digit grant, I think, is the absolute proof of what community can do when they are armed with data and meaningful, actionable information that helps turn problems into solutions. Next slide. And we are really delighted, and I'm personally honored to be a partner with you in doing that work. I would conclude by just sharing a few slides about our recent The Color of Health report, a report on health disparities by race that exist within our region. And I am incredibly appreciative of the fact that your mayor and county executive have been important leaders in understanding that all of our health inequities aren't explained away simply by socioeconomic status, by class issues. Some of them really relate to race and to ethnicity. And I am incredibly appreciative of how you all are partners in thinking about how this health improvement work is really aimed towards making sure that we not only improve overall community health, but that we eliminate the unnecessary differences in outcomes by race, some of which shown on this slide, that exist in our community. Next slide, please, Tom. And I think it's important that we do so because of the fact that these race and ethnicity related differences, this slide is showing racial differences. These differences persist across the socioeconomic spectrum. Income and education alone are not enough to inoculate us from the fact that there persist differences in society that lead to differences in health outcomes that we need to be a part of addressing as we seek to achieve overall health improvement. Next slide, Tom, and I'm out of your way, my friends. If you have not had a chance to familiarize yourself with either the overloaded report, The Nexus Between Poverty and Health, or The Color of Health, The Nexus Between Race and Health, I absolutely urge you to, in your leisure time, visit our website, final slide, Tom, which is commongroundhealth.org, and on our recent reports and publications link, you can access these reports, you can download the data, and you can feel free to use them to help inform the amazing work that you're doing, not just to uplift your corner of the region, but to really affirm that we remain not just the homes of Anthony and Douglas and Tubman and Twain, but that we really do remain one of the best places in this nation to raise a family. Thank you so very much. Really appreciate your time and attention, and looking forward to being a part of the rest of the conversation. Thanks, Andrea.
Wade, thank you. Thank you so much. I have to say that I've never heard you give an address or a keynote speech where I'm not taking copious notes. So I know that many are. We have some questions that are starting to come in from the chat box. And I mean, I couldn't write fast enough. So thank you for just pulling it together. I really appreciate that, and really summarizing the work that we've done, but also challenging us that our work isn't done. It's not over. And how important it is that we as a community take the data that Common Ground Health has helped us pull together, and that we are now armed as community. So to be forewarned is to be forearmed. We've got to do something with this. So thank you for your team. Their expertise. Appreciate Melissa Windland so much for the work that she and all the members of the team. We've had an opportunity to work with so many members of Common Ground Health, and thank you for your leadership. We actually say that they're part of the EOP family as we work together on this, because it is important to not just talk about the problems, but to allow that data to inform us to solutions. I heard so much. You said the differences in society can lead even to a difference in healthcare outcomes. Amen. And that has to be addressed, and it has to be addressed now. So we are honored to continue to partner with you and the team as we work together on these issues, but we are working together on them. As you said, from this data, from the health impact assessment, we were then able to, through the facilitation of Common Ground Health, work with our partners at Arnott and our partners at LECOM and our partners at the City of Elmira. So we're excited to move this forward. So thank you for the keynote. Thank you for the challenge. And now I want to invite, and I know that there's some questions that are going to be coming in as people are responding in Facebook and they're responding in live stream. But I also want to invite in our panel response experts. So we decided we would invite them in because we know they've been working on this area. And also we've all been working together and we're continuing to look for ways we can expand that partnership. And because this is truly a call to action. I've never been a part of any Common Ground Health meeting where there hasn't been a call to action. So we're ready. So I want to introduce Dr. Gina Kyler, Vice President of Health Equity and Community Investments from Excellus Blue Cross and Blue Shield. So welcome, Dr. Gina, and we're so glad that you're here. And also Mayor Dan Mandel, City of Elmira, and we are so honored that he is the EOP Vice President of
We lost Andrea for some reason. So I would encourage the panelists to jump in.
Well, thank you. Thank you so very much. I would love to thank Andrea, and I'll thank her when she comes back, for inviting me to this annual meeting. Wade, that was an excellent presentation, and I'm honored to be here tonight with Mayor Mandel, Andrea, and all of you. Now, there are many challenges that need to be addressed to advance health equity and to ensure that people can lead healthier and more secure lives. Addressing these challenges will take clear and well-defined data and metrics, which is one of the reasons why Common Ground is so near and dear to my heart. And we need that so that we can accurately measure the problems at hand and then be able to analyze that data and create actions such as programs and initiatives to be able to drive meaningful change and improve outcomes. When we speak of maternal health, there are many factors that result in high racial maternal health disparities, mortality, and severe maternal morbidity. And Wade alluded to a lot of these disparities. When I think about strategically addressing these issues, I break them down into three categories: advocacy, additional education, accountability. In terms of advocacy, there are many campaigns, such as the Hear Her campaign that focuses on making sure pregnant moms are heard. All of us can ensure that our pregnant humans are heard, and especially when it comes to disparities, that our Black and Brown pregnant humans are heard. Now, I use the word human here because I want to highlight that it is about caring for humanity. Too often, because of the color of their skin, Black and Brown people are not treated with the same level of compassion, caring, or concern that other humans are. This results in missed opportunities in care delivery that could lead to better outcomes. Everyone can be an advocate for those that are pregnant, whether it is your family member, a coworker, a neighbor, or a friend. You can support them in getting the care or action that they need when they ask for it. You can support them by not letting them give up asking for help from care providers because they're not feeling well or they're exhausted. And you can be an advocate with our legislators by asking for support for policies and laws that support improved maternal health outcomes. And that applies to everything else. We can advocate for funding for the initiatives that we need to be able to advance improved health outcomes. We've also seen efforts to support pregnant moms with Black doulas and community health workers. Many women are able to receive support and advocacy through those initiatives. And there's preliminary data showing positive outcomes. However, we know that there are women that need to go to the hospital, and we need health systems where everyone treated there can receive care free from bias, racism, and discrimination. We know this exists, and racism is one of the reasons why you can be a Black pregnant woman with a college degree and have worse maternal health outcomes than a white woman with without a high school education. There are countless stories of Black mothers with education and of means that have died because they and their families were not heard. They did not receive the care that they needed, nor the care that they deserved. The issue in these cases is race and not purely social determinants of health. This is where I believe the second intervention can be operationalized. Training regarding bias in maternal health, both in the intrapartum and postpartum period, is critical to address the challenges that exist with regards to bias and racism in healthcare. But training alone is not enough. There must be evidence that people have improved in how they treat their Black and brown pregnant patients. That brings me to accountability. Everyone involved in the care of a pregnant woman should be accountable. We need to do more than teach about bias. We need to ensure that we ask about bias and set standards with associated accountability for those standards. It could be in the form of accreditation, reimbursement, licensing, etc. But if we teach it, we need to ensure that patients see the benefit and the outcomes reflect some improvement and evidence that proficiency exists. Wade talked about the fact that most people believe that disparity only exists in urban areas. And I agree with him, unfortunately, that that is a misconception. As an internal medicine physician by training, I take any type of disease or disparity seriously. And I find that whether we are talking about humans in urban environments or humans in rural environments, disparities abound. And what we need to do is use that data. We need to use that information to meet people where they are and address the needs that they have in the communities in which they live. At Excellus, one of the things that I'm very, very excited and proud about is our spirit of collaboration. We're very excited to be able to collaborate with the Economic Opportunity Program, excited to collaborate with Common Ground Health. Wade mentioned the partnership about the clinic. And, you know, we are very excited that we were able to provide that Maki grant. And, you know, that clinic is going to be staffed by LECOM medical students with oversight by family medicine residents and attending physicians. And what we're going to find is the ability to do testing for lead and diabetes and behavioral health. And this is the true spirit of collaboration that we need to see in all of our communities to ensure that our members, our community, receive what they need when they need it. As we face this pandemic coming to an end, I think one of the things that's critical for us to appreciate is the toll that has befallen many of our communities and our community members. Inflation is on the rise, and people who previously may have been in lower socioeconomic classes and experienced the impact of social determinants of health are now joined by people who are in the middle class and are experiencing challenges with social determinants of health related to food insecurity, rising gas prices, rising housing costs, difficulty finding places to live. And so I think when we have a system in place that routinely addresses for social determinants of health, that routinely looks for disparities using data for all peoples in all regions, and takes that data and leverages it collaboratively so that we make sure we are working together to help people lead healthier, more secure lives wherever they may be. That is truly how we begin to advance health equity. And it can only be done in a collaborative fashion. And I'm very proud that we are part of this collaborative effort.
Thank you so much, Dr. Gina. I'm sorry I dropped off. I went off into some other place in cyberspace, but I was able to hear, so thank you. And we already have some questions coming in terms of your comments and Wade's comments. But before we start to address some of the questions, I'd like for Mayor Dan Mandel to jump in and really address some of the key areas. He serves the community in many areas. So we're really honored today to have you, Dr. Gina, here with your expertise representing the medical and community and public health component. Now, of course, have Wade here, as he says he holds the strategic numbers and the process there, but to also have one of our stakeholders, our own the vice president of our board, but also the mayor of a city. And so we're really honored to be able to have the perspective, because you've challenged us, both you and Wade have challenged us with, this is the data, this is what we see happening in our communities. Mayor Mandel, his experience of being the mayor of the city, also involved in law enforcement, corrections, and civic and community roles, he's had an opportunity with his team to begin to try to address some of these issues, and appreciation and collaboration that we've had. His background is Air Force and National Guard. He joined the sheriff's office, worked there for 26 years, and then he retired. And I just love this because he retired, but he didn't stop working. He got even busier. So Mayor Mandel, as you serve on the Elmira Water Board, and there are issues that we are talking about in terms of lead, as you serve on the Chemung County Age Advisory Group, a man-to-man forum on the Southern Tier Economic Growth Groups, vice president of the EOP Board of Directors, share with us, what your response is in terms of what you've heard, and you've heard the data before. You've been a part of the work with Wade Norwood and Common Ground Health, and also Excelis Blue Cross Blue Shield, because your team is working tirelessly to try to promote programs that really address, for example, these high lead levels, and address homelessness, and address these social inequities and other impacts to our community health and economic growth. So Mayor Mandel, will you jump in, and then we're
Sure.
going to address some of the questions that are coming in. Thank you.
Absolutely. First of all, Andrea, thank you very much. I'm honored to be here to speak. Dr. Gina, thank you for your input and information. Very important stuff. And Wade, as always, your dad is very important to us as we try to better our community and make it a better community for all. And there are a lot of disparities, and we do have high poverty areas here in the city of Elmira. Let's talk about the first problem we have to address, and that's lead. And I know there's been a lot of testing going on with lead. And so what we did is we actually obtained a grant from the federal government to abate lead out of some of these housing, some of these houses here in the city of Elmira. We got the grant right about 2020, just before the pandemic started. So it did hurt our progress a little bit. But I would like to report that we have cleaned up 10 to 11 houses, which is about 18 units, and we're able to remove lead from those units. We're also going to be submitting for another application to continue this program, because our goal is to remove all lead out of all housing in the city of Elmira. We have an older housing stock, so we need to address this. When we talk about the water board and the lead lines, we all know what happened to Flint, Michigan, and what happened there was a tragedy, and it should never happen in this country, period. The water board has been going through and replacing lead lines with more stable lines to keep our drinking water safe, especially for our children and for our community. I know their goal is to remove all those lead lines. We just signed on for a lead grant with them, and we just gave them some of our ARP money to help them assist with improving our drinking water here in our community, not only in the city of Elmira, but the other communities that access city water. When I was first elected in 2016, we applied for and received an ESPRI grant to address poverty in the city of Elmira. We worked with the EOP and to find out where do we need the most help in our city. And that's when we identified our census tracts, 6, 7, and 10, that really need a lot of attention. These people need assistance in finding jobs. They need assistance in education. They need adequate health care. I thought that was a great success. We were able to help a lot of families. As Andrea says, we give them a hand up, not a hand out, to help them better their lives and to get out of poverty, because poverty is, as we know, is cyclical. And in a country that's as great as ours, there shouldn't be this much poverty in our nation. So let's move on to one of the things we learned in ESPRI. Our housing stock needs to be improved. And Wade, I think you've touched on this. Housing is a major issue. Good housing promotes a healthy lifestyle. And so what we did is we went up to Harvard University and attended a City Rise grant development program. And what we've done is we've come up with some targets on what we need to do to improve the housing of the city. That is making landlords accountable that aren't keeping the housing stock in Elmira to where it needs to be. We're also doing inspections of 1 and 2 family homes that are rentals to make sure the housing is adequate for people. And then on top of that, and Wade has mentioned that, we have we've added additional housing in the city of Elmira, affordable housing that people can live in a decent place. So we've added Libertad, as we all know, in conjunction with EOP. We had the Arbor Girard block housing, was just completed last year. We're working on another project with Arbor on West Church Street and Academy Place for some more affordable housing. We had housing visions done several years ago over on the south side. And we also have Maple Ave senior apartments for those seniors that need adequate housing. So our goal is to give adequate and decent housing to all of our citizens. That's a goal that we're going to attain. And with that, we also have other people working on housing throughout our city, like Jim Capriati doing numerous projects and so forth. The one thing we started talking about when it comes to healthcare, and we've discussed this with the county and Dr. Terry, is an FQHC, bringing a federally qualified health center to our community. Those talks are going to continue. We'd love to see one come here to the city of Elmira. It would allow people that don't have access to healthcare, access to the healthcare they need, so they don't run into these problems that we see with diabetes, high blood pressure, and all the other things that afflict people that are in poverty. And let's face it, they have the higher rates of obesity and other health problems. The other thing I want to mention, now that we talk about my man-to-man group, one thing that we are doing with our man-to-man group is reaching out to men in our community to let them know the importance of getting checked for diabetes, getting checked for hypertension, cancer screenings, and all that. I'm trying to teach men to be proactive. We brought in mental health professionals before to do mental health forums. As we know, as we got through this pandemic, that there's a lot of depression going on right now. So, we're reaching out and trying to help people with mental health problems. Mental health is a major issue, not in our community, but throughout the country. So the other thing that we've talked about too with our man-to-man group is education, educating men, and also work on diet, proper diet, physical fitness, working out, keeping yourself healthy. I'm a fitness fanatic. I won't go to the gym several times a week. And I tell everybody, you want a healthy mind, healthy body, and a good attitude, go to the gym, work out, eat healthy, and you'll live a prosperous, healthy life, and your life expectancy will obviously increase. We've also worked with the anti-tobacco stack to do tobacco cessation efforts. People in poverty are the ones that smoke the most, and it's sad because that's what the tobacco companies target. That needs to stop. We try to get people so they can stop smoking and lead healthier lives through our man-to-man group. And, with mental health, last thing I'd like to touch on comes with substance abuse. A lot of these people are not getting the adequate treatment for their mental health problems. So they have what they call a co-occurring disorder, where they have mental health problems plus alcohol and drug abuse. So we got to address all these. And with our man-to-man group, that's one of our goals, on top of everything else that we're doing in the city. So that's pretty much everything in a nutshell that we're doing here in the city to make the community a healthier, better place to live, to get people out of poverty and get them the adequate health care they need. Okay.
Mayor Mandel, that was packed. That was loaded. I mean, we're going to need another session to unpack all that you're working on, which is really wonderful, and it's great. I mean, we're all honored to partner with it. I want to also now, and thank you both, you and Dr. Gina Kyler, for your comments, your expert response to Wade Norwood's keynote. But I also want to go back because I wasn't sure at what point I dropped off, because some may not even know. And the first question is going to go to you, Dr. Gina. Dr. Gina is the Vice President of Health Equity and Community Investment at Excellus, and she's board certified as an internal medicine physician. When you started talking about exercise, Mayor Dan, she started smiling and shaking her head. That's probably what she spends most of her time talking to her patients about. But Dr. Gina is a physician, an author, an educator. She's a sought-after speaker. She's an avid patient and community advocate. So I want to encourage you, if you haven't read her book on patient advocacy, get it. It's an informative book. Education will give you the language so that even when you're working with a health professional, it'll help you more effectively navigate that system. As the Vice President of Health Equity and Community Investments for Excellus Blue Cross and Blue Shield, she sets direction for that organization to promote health equity, cultural sensitivity, and community health. So her medical degree is from the University of Rochester. She did her residency there. So she has been in upstate New York. She knows our area and our region. So we're really glad to have Dr. Gina here as one of our expert response panelists. And also the first question is going to go to you. So first question has come in, and it actually is a question that says, what is the most prominent death in infants under 1 year?
Well, that's one of those things that I think it depends on where you are. I'm not a pediatrician, so that was one class that I moved on from. It was too sad for me in medical school. But I think there, in the United States, and Wade probably would have the data behind this, especially for the region. So I'm probably going to punt to him on that one. But globally, we think about causes such as malnutrition, illness, infection. I think here in the United States, the challenges we often see is sudden infant death syndrome, challenges with premature birth, prematurity. Wade, do you have any other data on that?
I would just add, Doc, and I think you hit it right. I mean, if we look nationally, birth defects, preterm birth and low birth weight, injuries, suffocation, SIDS, as Dr. Gina said, and those congenital issues related to preterm complications are what stand out nationally. I'd say of significance for our region are not just the deaths related to, but the health complications that are associated with premature delivery and low birth weight. And I would challenge our understanding that those things are not simply the result of mom, but rather the interplay of all of the circumstances in which mom lives. And a low birth weight preterm delivery is a delivery that is predisposed to associating all of the costs of children with special and unique needs. And my oldest daughter was a child born with special and unique needs. And those costs are not just financial. They really weigh on families. And then they kick in to be costs borne by communities, cities, counties, and school districts as those children live with the need for special care services. And this is where that chart about income not being a protective factor is personally gripping, because my wife is a poster child for all of healthy living and healthy eating. And it is not an experience that we ever expected to have. But it is a miracle, that thing called birth. And that thing called labor and delivery takes all of us as a community working together to support mom and dad and baby. And I am most excited about how the work of the EOP really has become, thank you, Andrea, thank you, Mayor Mendel, it really has become, how do we wrap the community cocoon of love around one another to make sure that every baby and child in our community has not only the best head start, but that amazing rocket fuel called love to help ensure the highest and best trajectory available.
And we can also leverage the information that we have from before conception, right? We know about the relationship between anxiety and depression, which we're seeing so much of right now, related to the pandemic and related to the economy. We know that we can predict that there's a greater incidence of postpartum depression in those patients. And so we don't have to be surprised by that. We can be proactive. We can set up infrastructures to address those things. And Healthier Mom, just like Wade says, healthier baby. And we can come together collectively and start addressing the care and the outcomes, right, much earlier than we are doing now.
Amen.
Absolutely. Absolutely. Healthy and happy mom, healthy community. You know, that's important. Thank you. Thank you, Dr. Gina. Thank you, Wade. Dan, Mayor Mandel, what's come in is a question that says, not sure if there's data yet, but this individual said, I trust the recently started City of Elmira 1 and 2 family rental inspections are also helping on lead. So I think that's the question that's come in to you, Mayor Mandel.
Yeah, we just started those, and yes, it has, and it will continue. They'll be able to identify those homes that have lead in them and direct the landlord on how to attain the funding from the city to clean those houses up. So that's going to be a great help.
That's wonderful. Thank you so much, Mayor Dan, because again, do you see the linkage? Even when we, through the Cell Clinic, test the Head Start children and their families, if we find lead, we're then able to connect with the City of Elmira. So we're connecting the dots. So we truly get an impact, because it isn't just the child that has the lead. As Wade said, it's the whole environment. So we're able to then more systemically go after it. So we're really glad. Dr. Gina, there's a question that's coming for you. And also there's one we're trying to trail down to get through them for you, Wade. So we're going to keep moving through this. Dr. Gina, how can we get info on our, get info to our young mothers with some information and tips about when they visit their doctors? Education is so important, along with workshops or however it can be disseminated. Do you have any suggestions that would be great? Thank you.
Excuse me. I think there are several things that can be done. One, I think we as an institution, whether or not we're talking about hospitals or clinics or insurance companies, need to make that information readily available. Having some type of a location, either on a website or on a portal, where people can click what to do when pregnant and be able to access information quickly, what your benefits are, what are you covered for, are you covered for lactation, are you covered for a doula, what are you covered for wherever you are. Be able to get those answers quickly so that you can plan accordingly. The other thing that I think we have to do is leverage technology more effectively. I think we need to ensure that we are regularly putting out informational programming, so that we can say, okay, are you expecting, here's some information for the first trimester. Here's some information for the second trimester. Make it free, make it accessible, make it easy to understand. And I think we also have to give patients the opportunity to be able to get the answers to the questions they need. Because oftentimes, one of the things that I've always found is if you don't understand the context of the situation, it's hard to even put a question together to be able to get yourself out of the knowledge deficit. And so I think we have to empower patients with the tools that they need. What should you be doing when you show up at your doctor's appointment? What questions should you be asking? What to do if you feel as though you're not getting the care that you deserve? What are your recourses? Who can you call? Who can help intercede for you? All of these things I think are critical to ensuring that mom can have the outcome that she deserves and the care she should receive. And so it's a continuum of intervention that I think, we can provide for moms.
Excellent. Thank you, Dr. Gina. That's excellent, because again, sometimes I don't even know enough to frame a question, as you're saying. So I think that's so important as we go through. Also, there's another question that's come in. This one says, thank you for an exceptional presentation. It appears that, and this is in quotes, majority culture is tired of tax breaks and subsidies for the disadvantaged. How have you helped well-off citizens see what is in it for them? And I think, Wade, you want to address that, or anyone else on our panel who might want to jump in?
Sure. I think it's an excellent question. And I think it is all about not positioning the work that's required for health improvement and health equity as charity, but rather as central to regional economic and community development. And that's why I like to start with this picture of what health outcomes look like, because years of potential life loss are really about productivity losses. It's about inefficiency in our system that we are really allowing for the expertise, the skill set, the interpersonal leadership of elders in our community, gentlemen like my dad, who passed away at age 63, far too young. The role he could have played as a grandfather if he had seen more than just one of his grandchildren graduate from high school. The role that he could be playing as a community leader today, had he lived to actually see his grandchildren marry and have great grandchildren. This is a loss. This is an economic loss that we estimate is at about a level of $1 billion a year. $1 billion a year in this community that is being squandered every single year. I believe that putting the facts in front of our neighbors will allow our neighbors, regardless of their income or their ideological persuasion, to say we need to do something here because life is better than death, simply because good is better than evil. And I'm excited to be a partner with you all, because I think it's important that we make sure that people in our community, in our region, understand this is not an urban, suburban, rural. This is not a black-white issue. This is not a rich or poor issue. This is a human issue.
Absolutely.
And it is an issue that is actionable. And you all in Elmira are proving all it takes is a little bit of resource and a whole lot of community. And boy, what a change we can make.
Absolutely. Well spoken. You know, I often say that if one of us hurts, we all hurt. But when one of us heals, we can heal a community.
Amen, Andrea. I'm stealing that from you.
And even from an economic standpoint, I mean, I just want to say this point. You know, we're in a time where businesses struggle to find workers. And we have seen a lot of businesses close coming through the pandemic. And each and every single human being, when they suffer from illness and disease, there is a human capital cost. That is a worker who cannot work. That is a solution that may not come to fruition because we're not taking advantage of someone's gifting, someone's talent, somebody's innovation. And so we miss out on so many fronts. And I think that we have to stop thinking about it as them versus us. We have to start thinking about it as how do we leverage the gifts and talents of every single human being to make our communities thrive and be successful? And how do we come together using data to make the right decisions, to address the right problems at the right time to get the outcomes that we need?
Absolutely. I often say right people, right place, right time. How do we do that? Yes, absolutely. Now, there are a couple of questions that are coming in, and I want to make sure we get them, and then we're going to close. Now, you can tell I'm starting to sit back in my chair, which means we could be here all night. But all I need is a cup of tea, and we'll just keep. This is great. It feels like you're in your family room just having a conversation. But we have folks who are out there, more than 100 people who are out there listening to us. And so this one came in from Nathan. It says, given the link between home ownership, Mayor Mandel, and improved health outcomes, Dr. Gina, and also Wade, what programs are available to assist lower income households in the city of Elmira? So this is truly a city of Elmira question, to help them purchase homes. And of course, to help them purchase homes that have lead abatement, really solid, good homes.
Yeah, and that's an excellent question. And what we do with our community development, we work with Catholic Charities for a first-time home buyers program. I encourage everybody that may be low to moderate income to reach out to them, and they will help them to purchase a house. They go through some classes to learn how to make payments and all that. So Catholic Charities, reach out to them. They do a first-time homebuyer program. For those that own houses in the city of Elmira who may be struggling and meet the income threshold through our community development, we also offer grants through our community development block grant program, or excuse me, our community development program office. And basically they will get them the funding they need to do windows, to do siding, to upgrade sidewalks, to improve their properties. So that's also available for people that are in lower income. So there's a couple of ways of people that want to buy a house, and ways that people already have a house that want to improve that housing through the city of Elmira.
That's wonderful. Thank you, Mayor Mandel. And some of the work that we began with Esprit, when we talked about it, the city of Elmira was right there along with Chemung County, moving forward. And downtown, we're seeing the improvement that's already happening in our downtown. And now we're hoping to even perhaps work with Capriati Properties and some other folks in the community to begin to expand that further in the community. So we will continue the work. We are not just talking about, we reviewed this data, it got filed away. We have action steps, and we're seeing that improvement. So thank you, Mayor Mandel, for that update. There's another one that came in for you, Mr. Norwood, and this says, is there a dental clinic that will take care of people that have Medicaid in your area? Marginalized people and people in poverty should get good dental care from inception and should not have to lose their teeth. Most of the people in our community are sent to Rochester area for dental care. So are there any best practices around, ideas of how to address that?
I don't necessarily know if I have an answer for Ms. Lewis, but certainly as a response, I think it's important for us to really understand in our increasingly service-oriented economy how important oral health and oral presentation are to economic livelihood. And I think, again, in those list of things that we fail to appreciate, I think we fail to appreciate in our region how many folks are dependent on well water, and what oral health looks like in rural areas being very different than in more urbanized areas. I do not know enough. I apologize that you all have me and not Melissa Windland to be able to comment on what are dental services that are available in Central Southern Tier. But I would note that the value of St. Joseph's Neighborhood Center in Rochester is its ability to provide services to people who are insured but don't have insurance to cover adult dental care. And I think it's that growing attention to underinsuredness and that growing attention to making sure that insurance coverage reaches the totality of people's health experience that makes us a blessed community to have Excelis Blue Cross Blue Shield as such a dominant part of our insurance market. I talk with colleagues around the country who say to me that they don't have a hometown insurer. They don't have an insurer that operates from a not-for-profit perspective. Instead of responding to shareholders. And I think the very fact that we can have these types of conversations and have someone from one of our local insurers present and able to not just contribute, but as the Mackey grant demonstrates, be part of innovating where there's not an answer, not taking no answer as the answer, but saying, how do we partner with community, knock on that door, and make a way out of no way? I think we have continued opportunity, and That's why I don't engage in idle flattery, because I'm just too busy. That's why we're also blessed to have the mayor with us, because having city leadership thinking about health issues helps us. So to the questioner, I think that that's a area that I'll find answers to, and make sure that we at Common Ground Health are talking with you all at the EOP, and
Okay,
making
great.
sure that where there are gaps, that there are folks who are willing to stand in that gap.
Excellent. Thank you. Thank you. And having done all to stand, so we're going to keep standing because we are built to last. Dr. Gina, it looks like you want to jump in.
I did want to say, this is an issue that we were just talking about the other day. The regional president, Jessica Renner, in the region, and I have been looking into what is going on with dental care and really trying to think about ways that we can look into supporting this need in the community. So between all of us, I'm hoping that we'll be able to collaborate together to come up with some kind of a solution to help advance health equity in that area in the community.
That's wonderful. And thank you. We appreciate you. I know that if you and Jessica Renner are putting your heads together on it, we're going to have a solution. So, and we'll be a part of that. Just let us know what role we need to play. So thank you. Now, there are two more comments that I want us to address, and then we're going to close. As I could say, I'm about to sit back and get a cup of tea. This could go on. And we will invite you back as we will have some smaller group and next step discussions. This question comes, and it actually says, Mayor Mandel, can you talk about anti-displacement? Because we run a program through Libertad Elmira where we work with homeless veterans, and we have put them into fully furnished apartments. And there's next steps to this work that you're already engaging in with the anti-displacement program. So you want to jump in and share a little bit about that, and then we'll finish up with our final question. And that question we will hit as we talk about small cities that might be bright lights. So Mayor Dan, if you'll jump in on anti-displacement, and then we'll finish up.
I almost forgot to mention that, and we've actually partnered with EOP on this initiative. We know that after the pandemic and with the moratorium coming to close on the evictions, that we're going to have to do something to help people find housing. Not only that, now that we're doing more of these inspections and all that of these houses, 1 and 2 family, and as we go through and enact our City Rise plan, we may have to displace people until the landlords can get these properties back up to code and back in decent shape where these people can live. So in a nutshell, that's what that money's going towards, to help these people find decent housing. We've partnered with EOP to take the lead on this. We're very happy about that. And they're going to be assisting us in this endeavor and attack the problem of displacement and homelessness in the area. So.
Yeah, thank you, Mr. Mandel, Mayor Mandel. Thank you for the opportunity, because for us, we know that we're working with members of our community, and as case managers, our team, they're extremely competent in working and being on the ground, touching people. And because we say, how can we serve a community that we don't know, or a community that we're afraid to touch? So thank you for the opportunity where we're pairing a problem like homelessness, but with a group of case managers who can go in and begin to look at the entire system and address and come up with solutions that look at all those components in terms of social determinants of health and even housing security. So thank you for that opportunity. So the last question, and anyone in our keynote speaker or panel experts, Harriet asked, are there any small cities to point to as bright lights for programs and collaborations that are moving the needle to improve health outcomes for the BIPOC communities? Any bright lights? We think Elmira, but again, we have more work to do. We have a lot more work to do. So.
Well, I mean, I would say that we're at a place of birth, in a sense. I think nationally, the last few years, the COVID pandemic, the social unrest that had happened nationally has really fostered a new conversation about how we move forward and address these issues so we don't keep having the same conversations over and over. And I think we're seeing a lot of innovation in our communities. I think that different communities face different challenges. So what we would have to really look at is how each community is addressing the challenges that they're facing, because it's oftentimes difficult to compare one community apples to apples to another due to size and demographics and so on and so forth. I will say that there are some places in the country where you are having a lot of collaboration. I would say Elmira is one of them, if you would stop to think about it. When you're talking about the topography that Common Ground is engaging in Elmira, where, you know, we are engaging as a health plan, despite we have a 39 county footprint, but we're here and we're present in each and every single one of those places looking to build relationships. I think that that is a model to be proud of. And I think that this type of collaborative model is truly a beacon of light and hope in our context of disparity. And I think that this is something that should be replicated across the nation. So I don't mean to pat ourselves on the back. However, I'm quite proud to be a part of this work and proud to work with these fine people here tonight, and proud to be able to serve and support this community.
Thank you. Thank you so much, Dr. Gina Kyler, Excellus Blue Cross Blue Shield. Well spoken. Wade, do you want to have closing comments before we segue to our
I'll happily offer closing comments. And I would say, as I thought of small cities listening to Dr. Gina's comments, Richmond, Virginia, Manchester, New Hampshire. I mean, there are places that are really understanding as a result of COVID how much Americans are really looking for community, how much Americans are really desiring, how can I find safety in communities that are more centered around the human scale. I, like Dr. Kyler, do not think it is idle flattery to say that, quite honestly, upstate New York, the Finger Lakes region, Elmira and Corning have the opportunity to really be on the leading edge of that, because of the fact that you all are having a conversation that doesn't place health outside of everything else. But really, as we've been talking here, health is economic development. It is educational improvement. It is civic pride. It is what brings us together and allows us to know that we've got another 40 years of loving each other.
Absolutely.
If we can live healthy and support each other in the effort to do so. And I am incredibly blessed every morning to wake up and say that I do that, not just for Clinton Avenue in the city of Rochester, but I get to do it with partners in Canandaigua, and I get to do it with partners in Corning. I am incredibly grateful for this opportunity, proud to have keynoted, and already have zipped an email to my friend Gina to say how exciting Andrea is to have put us together with Mayor Dan. Thank you very much. And thank all of you all who dialed in and gave a part of your evening to join us.
Yes, thank you so much. I mean, powerful closing remarks from all of you. And thank you. I can't thank you enough. Again, Wade Norwood, CEO of Common Ground Health, Dr. Gina Kyler, Vice President of Excellus Blue Cross Blue Shield, and Mayor Dan Mandel, City of Elmira, Vice President of the Economic Opportunity Board of Directors. I want to thank you. I often say I get by with a little help from my friends. So thank you for just all the wealth of knowledge that you've shared with us, but also the call to action. I can't thank you for that. We do have our work cut out for us, but together as community, we can continue to move forward. We can refocus our efforts. I heard that from all of you. But we need help from everyone who attended. We had more than 100 people who were on tonight, and we thank you. But the call of action, I'm calling you to action as well. And so we need you right now. We want to thank our keynote speaker and also our expert panels. What they shared, the information was absolutely outstanding. But we also want to continue to have a call to action because community is so important. Health is wealth. And so when we began to talk about economic development, we want to make sure that we continue to move forward. Even as we are dealing with COVID-19, we've talked about the importance of community. So help us tonight. We want you to take a poll because we need your feedback. We already have shared our strategic areas of focus, but we need you to rank the top 3 priorities for EOP for 2022. We need your feedback as stakeholders in our community. So these are the key areas. So go right now to take this poll. We want you to rank the top 3 priorities: community health, flexible and safe childcare, housing availability, COVID-19 response, food insecurity. So we need you to rank that. And also, if we find that you have other questions that perhaps you put in the chat box, we'll make sure that our experts from tonight, that we're able to connect you to them and their organizations so we can continue this dialogue. This isn't over. You can tell from our earlier, those of you who attended our earlier strategic overviews and annual meetings, we are continuing the work and we're continuing the work strong. So we need you to be involved. We need your help. And again, we need you to help us move forward. If you'd like to receive a digital copy of our annual report, which goes into more detail about all of our programs and services, our devoted staff of more than 100 are providing programs and services in the community that support you. You partner with us, but there's more that you can do. Please feel free. If you'd like to get a digital copy, you can get that. You can actually don't purchase it, but we'll send it out to you. You can go to this link, cseop.org/community-impact. So you can have an updated annual report. Also, please feel free. You can donate to support our programs and services. And so feel free to text EOP to 607-333-7599 to get a link to donate. And we will take cash, checks, credit cards, feel free, because making a donation to EOP, your generosity makes an immediate difference to helping our community. So we thank you. Many of you have already donated, but we thank you for continuing to support the work that we're doing here. Please also volunteer. We had so many people who helped our staff. When COVID hit in March 2020, they continued to help and support with volunteerism. We have more than 250 volunteers. So please feel free to just contact us if you're interested. You can put it in the chat box. And also share this information with others. I learned so much tonight. And I want to appreciate Wade Norwood, Dr. Gina Kyler, and Mayor Dan Mandel. I learned so much tonight, and I'm sure that you learned probably many things like I did. So please share the information that you've learned with others. Even as you get a digital annual report, you can also share that with your work teams and members of the community and your family. Because again, we want to continue to determine how we might work together as a community. So we are committed to serve this community for at least another 57 years. We're focused together at our core values of children, families, and community growth and development. EOP, we are built to last, and we're working to ensure that our community is built to last as well. We believe that the only truly reliable source of stability is a strong inner core of values, and the willingness to change and to adapt everything except that core, except those core values. That's a great quote from Built to Last by James C. Collins. So I want to thank you for joining us for the 57th annual meeting of the Economic Opportunity Program. Please note that our annual report will be available tomorrow, so we can begin making sure that you have access to that. Thanks so much, Tom. We want to give a shout out to Tom Brown and our tech team. They did a phenomenal job. And again, we want to thank each of you, because we wouldn't be able to accomplish any of this without your support. We are a community. We're working together. Can you imagine what we can do together? So again, President Herb Smith, he's going to close us out. And I want to thank each and every one of you for joining in tonight. Thank you.
What a great time this was. Each year it gets better and better, and it continues to grow. I want to thank you all for coming. And now we're in adjournment. Thank you all. Bye-bye.
Thank you. Have a good night, everyone.